All right, what is going on, folks? Welcome back to another episode of the Help Me Understand podcast. I'm your host, JK, and we are kicking off episode number 194 of Help Me Understand. Before getting into today's fitness and health focused Tuesday episode, today we're going to be spending just a few minutes talking about body fat and the body fat that primarily people aren't really talking about when they talk about wanting to change their body composition. First, before we get into that, we are going to take a moment, as always, to say thank you and express a moment of gratitude. So, thank you for choosing to press play on the Help Me Understand podcast. I know that you have no shortage of podcasts that you can listen to and or watch. Shout out to those who may be watching this episode on YouTube. So I certainly never take it for granted, truly never take it for granted that you chose to press play on the Help Me Understand podcast. So let's get into today's episode. I want to give you a little bit of background on how I actually arrived at deciding to talk about this particular topic. And this will be probably a moderate time length episode. I doubt we're going to go more than about 15 minutes at the most here. So where this particular topic is coming from, two very specific pieces. One angle that it's coming from is a conversation that I had with someone within the past 2 to 3 weeks, and just having a discussion with this particular individual about some goals that they have. And one of the things that was really motivating them initially when we got on the phone to have a conversation was that they really wanted to change the amount of belly fat that they had. It opened up a really good conversation between myself and this person, just talking about some of what their beliefs were when it came to belly fat, and then being able to have them be open to listening to my point of view, my perspective on understanding what you can and can't control when it comes to targeting belly fat. Newsflash, to my knowledge, still, I believe this, you cannot tell your body where to lose body fat from. So the most common phrase that you'll hear is you can't spot reduce, or you can't target belly fat specifically. Overall, in order for body fat to reduce, you would need to be in some sort of a caloric deficit. And then this then opens up a whole host of other conversations about hormones and all sorts of things like that. However, in this particular conversation, we focused a lot around first just unpacking beliefs on both sides, both my side and their side, about understanding the goal that they had with targeting belly fat. And then also that then morphed into an overall conversation around lifestyle and habits, including the 3 pillars that I typically like to bring up in just about every conversation that I initially have with someone, which is eating well, sleeping enough, and getting exercise in regularly. All 3 of those things different for each person. And for the most part, you'll typically hear me talk about those 3 things: eat well, sleep enough, exercise regularly, and take care of your mentals, whether that is projecting or directing your mindset in a neutral to positive way, or specifically like your mentals, your mental health, just everything that falls under your mentals, basically. So that was one angle that this topic is coming from. The other angle that it's coming from, which was really kind of more indirect, I'm working on some content that I'm going to put out at some point on social media, just with a couple of thoughts that I have on the perspective of whether or not there are benefits and or risks, spoiler alert, there's both, to using a weighted vest for exercise. So when I was doing a little bit of, can we even call it research anymore if you just hop on Google and do some searching? As I was doing some internet searching around the topic of using weighted vests for exercise, whether it be rucking or doing actual workouts like squats and push-ups and different things like that with a weighted vest. Shout out to those who are in the CrossFit community. If you've done like the Murph Memorial Hero WOD, you're very familiar with like the weighted vest and that sort of a thing. As I was doing some internet searching around that particular topic, I came across a particular study that was talking about, or it was a study where they compared what the results looked like for a group of people who used a weighted vest for their exercise with another group that I believe just performed just basic exercise, I think without a weighted vest, if I remember correctly. I might be kind of mixing that up. What I do remember correctly, I believe, is that one of the quote unquote surprising finds from this particular research study was that the folks who wore a weighted vest for their exercise were able to reduce their body fat while maintaining, for the most part, maintaining their muscle mass. So they just found that to be interesting that by wearing a weighted vest, they were able to change their body composition and still hold on to a good amount of the muscle mass that they had while also reducing body fat. So that even kind of goes to some of those questions that will come up with, is it possible to build muscle and lose fat at the same time? In this particular study, what it seems like is that the outcome is that folks were able to lose fat and at the very least maintain muscle at the same time. I can't remember if they were talking about trained or untrained individuals on that one, but stay tuned. That's some content that will be coming out at some point. So how that relates to today's topic with talking about specifically body fat was just that outcome that they had, that the individuals lost body fat by wearing a weighted vest during exercise. So what I started thinking about when I take that and then combine it with the conversation that I had with this individual within the last 2 to 3 weeks was just spending a few minutes talking about visceral fat. So for those who may not be aware, I'm going to basically put body fat into two categories. So there is subcutaneous fat, which is fat that's stored just directly underneath your skin. And then there is visceral fat. Visceral fat is not stored directly underneath the skin. Visceral fat is actually fat that is around your organs. So internal fat that is around organs like your liver, your intestines, and your pancreas. Those are some things that kind of come to mind for me. So when folks are talking about wanting to lose body fat, most of the time what they're really referring to is they're referring to subcutaneous fat. So they're talking about the body fat that you can actually, for lack of a better way to put it, you could kind of pinch and tug at if you wanted to. You could pinch your arms, your legs, and around your abdomen. So the thing with subcutaneous fat, number one, that's what most people, from my perspective, tend to focus on when they talk about wanting to lose body fat. They're primarily talking about body fat that they believe they can visually see. Now, I'm not crazy enough to think that you can see underneath your skin, but what I'm talking about is if somebody is talking about, hey, I feel like my arms are quote unquote flabby, or I just have this extra, they're grabbing their quote unquote love handle and kind of pulling at their side and talking about that, they're typically talking about subcutaneous fat. So the interesting thing is that generally within the medical field, the conversation about risk of high body fat is typically not specifically talking about the risk of having high subcutaneous fat. They're actually talking about having a high risk of visceral fat. So again, remember that visceral fat is the fat that is around your organs versus subcutaneous fat, which is basically the fat that's just underneath your skin. So this reminds me of talking to somebody not that long ago who had been at the doctor and had been diagnosed with a couple of medical issues that they had. And they asked the doctor what they could potentially do to try and reduce the risks of these particular medical conditions worsening. And what the doctor told them to do was, hey, you probably need to, get a control of your diet and lose some weight. So you probably need to lose weight and cut some body fat. Not really any sort of conversation about strength training or anything like that, which is kind of interesting because the thing that typically will have generally the most effect on visceral fat is things like of course, paying attention to your diet. And two previous episodes ago, I talked about the whole question of can you outwork a bad diet and all that stuff. So having a solid diet, and then also having a solid strength training and cardiovascular exercise routine are things that can directly have a positive effect on the amount of visceral fat that someone has on their body. So in this instance, when I was talking to this individual a while back who had said that they were asking their doctor, hey, what are some things that I can potentially do in order to reduce the potential risk of what's going on? Their doctor basically told them lose weight, cut body fat. So they are initially thinking, okay, well, what I'm going to see, so the aesthetics that I'm looking at, like those are the things that are going to tell me whether or not I'm on the right path. And while that could definitely be an indicator, so that's something that definitely can be part of the data that we're looking at when we're talking about overall losing body fat, if we're not separating it between subcutaneous and visceral fat. At the end of the day, subcutaneous fat is going to primarily focus on what we're seeing aesthetically versus visceral fat, which is going to really focus on a lot of your internal health markers. So your internal health markers being things like your blood pressure, triglycerides, just different things like that. A lot of times when somebody does have a high amount of visceral fat, and again, visceral fat being the fat that surrounds your internal organs, this is where we start to potentially see higher risk of things like any sort of metabolic disorder, diabetes, and potentially even heart disease. Now, there is some literature out there for sure. At this point, you could say that about anything. There's literature of all sorts about all sorts of things. So there is, however, some literature that is out there that does talk about, I believe it's hip to waist ratio or waist to hip ratio being potentially an indicator of having too high for that individual, too high of an amount of visceral fat. Again, I'm going to continue to remind you, visceral fat being the fat that is surrounding your internal organs. So if you have an individual who is being told that they're at a very high risk for things like heart disease, diabetes, and all that other stuff, and they specifically are looking to try and improve that particular situation, there is a chance that having a focus on understanding where their measurements are as far as their abdomen. So if they're looking at like their waist to hip ratio, there were a couple of numbers that were thrown out as I was kind of looking at this as far as like what's recommended for males and females. I'll be straight up with you. I haven't really done a deep dive to be able to back up those particular numbers as far as how much is too much for particular individuals. So I just very transparently, I don't feel really comfortable throwing those numbers out because I have nothing to back those up. What I will say is that if you are someone who is experiencing some of the signals of heart disease, diabetes, any sort of medical disorders, and also believe that you have a high amount of fat around your abdomen. Now, we're not talking like people just feel like they're kind of bloated sometimes or things like that. And again, I almost like hesitate to even talk about this. However, I want to have real conversations about real things that real people are talking about and have those responsibly. If you are feeling like that and these things are all in conjunction, so it's not like just one thing or the other, you're just noticing that all of these different things are going on, then that potentially is a sign where there needs to be more of a focus on, in no particular order, making sure that you have somewhat of a well-balanced diet, particularly like high nutrient dense food choices that you're making. You're staying hydrated. You're working on trying to control and manage times of high stress and low stress. I'm certainly not one of those people who thinks that you're going to eliminate stress. I don't know that I even recommend completely eliminating all stress out of your life because I start to question like, then how do you prepare yourself for times that will be high stress? So you got to be able to stress test every now and then. So some sort of stress management protocols that are in place. Also making sure that you are focused on having some sort of a wind down routine and some sort of a regular wake up routine, some things that you do that really kind of pour into yourself, having control over the start of your day. So how are you eating? How are you sleeping? How are you taking care of your mentals? And then certainly goes without saying here, if you're hanging out in my world, we're definitely putting some focus into some form of resistance training, and then also getting in enough cardio to ensure that you are doing what you can to maintain cardiovascular health, whether that be for everyday activities, and or if you're somebody who also from time to time knows that you're going to be in a situation where there's going to be a high demand of cardiovascular load, like some position where, I'm in a position where every now and then I've got to do like a quick burst to lift something super heavy up off the ground with a couple of other people. So if I'm never putting myself in a position to train for that sort of a thing, having a squat down, quick burst up, think kind of like almost like Olympic lifting, that sort of a thing, although I don't do a lot of that. I do dynamic movements and explosive movements, I should say, under load from time to time, just to ensure that that's something that my body can still handle, and most importantly, that my heart can still handle and recover from time to time. If you are doing those particular things, then you likely are someone who is putting yourself in a really solid position to focus on reducing the visceral fat. So again, I'm going to start to wrap up this particular episode. My whole point for jumping on to have this particular conversation, or at least to share this information with you, was to dig a little bit deeper, pardon the pun, but go a little deeper than surface level when we're talking about really what's the most important fat to try to reduce. And more often than not, when people are talking about reducing body fat, they are typically talking about reducing subcutaneous fat, which is basically like that first layer that tends to be the quote unquote visible layer, which is where you feel like you've got a little extra belly fat, you got a little extra love handle, you got a little extra on your thighs, whatever you're telling yourself. Like that's the area that people are typically focused on, and not necessarily as focused on the fat that actually, for lack of a better way to put it, matters the most, which is going to be your visceral fat, because your visceral fat is what, if you've got too much, if you have too high of a percentage of that based on what's going on, that is the thing that can directly lead to metabolic issues, disease, heart disease, diabetes, all that stuff. So when myself and other coaches that I vibe with are talking about the inside out approach and really the health first mindset as we are along the journey to getting the aesthetics that we want, this is low key, high key, one of the reasons why we're focused on the consistent foundational habits, because we know that when you're talking about reducing body fat, you're talking about 9 times out of 10, you're typically talking about the appearance of something versus really understanding that we got to start with the deeper layer of body fat, which is actually going to be the body fat surrounding the organs that are responsible for keeping your internal functions working and keeping you alive. All right. So with that said, this was going to be about 20 minutes or maybe less. I'm touching up about 19 minutes right now. So we are going to go ahead and bring things to a close. So if you have listened this long, I want to say thank you for choosing to press play on the Help Me Understand podcast. If you have a moment to leave a rating and or review, a like, a subscribe, a share, a repost on Instagram, and tag me at Coach JK McLeod, I'd appreciate any and or all of those things. Pass this episode on to a friend, whatever you can do to help spread the love for Help Me Understand, I would appreciate it. All right. So thank you again for listening. Take care, and I'll talk to you next time.